Did you know that something as common as a change in bowel habits could be a sign of something as serious as colon cancer? It's true, and it's why we need to talk about it. Today, we're addressing a crucial health issue that affects millions yet often goes undiscussed: colon cancer. This video isn't just about statistics or medical jargon, it's about understanding the critical symptoms of a condition that can be life-altering. Knowing what signs should never be ignored can be the key to early detection and successful treatment. Our aim is to empower you with knowledge and awareness about colon cancer, potentially saving lives through education. What exactly is colon cancer? This type of cancer begins in the large intestine or the rectum, often from small, benign clumps of cells called polyps. While some polyps remain harmless, others can develop into cancer over time. Colon cancer is alarmingly common, yet many of us are unaware of its risk factors and prevalence. Age, lifestyle choices, and genetic predisposition play significant roles in its development. Understanding these factors is not just about statistics, it's about realizing the importance of early detection, which significantly improves the chances of successful treatment. As we explore the symptoms of colon cancer, it's vital to remember that they can differ widely among individuals. Not every symptom directly indicates colon cancer, but knowing what to look for is crucial. This video is designed to educate and inform, but it is not a replacement for professional medical advice. For any personal health concerns or symptoms, consulting with a healthcare professional is always the best course of action. Now let's start with symptom 1, change in bowel habits. Continuing our discussion, a significant symptom to be aware of is a change in bowel habits. According to a study published in the Journal of Gastrointestinal Oncology in 2022, changes in bowel movement patterns can be early indicators of colon cancer. This includes experiencing diarrhea, constipation, or a noticeable change in the consistency of your stool, like narrowing, that persists for more than a few days. It's important to understand that while these symptoms can be associated with less serious conditions, their persistence is what raises concern. The journal article emphasizes that any significant, unexplained changes in bowel habits, especially if accompanied by other symptoms like abdominal pain or blood in the stool, warrant a consultation with a healthcare professional. This is particularly crucial if you're over 50 or have risk factors like a family history of colon cancer. Remember, these changes in bowel habits can be subtle and easily overlooked. However, being attentive to your body and responding to these changes promptly can be crucial for early detection and effective treatment of colon cancer. Next, symptom 2, rectal bleeding or blood in stool. Another critical symptom that must not be overlooked is rectal bleeding or the presence of blood in the stool. A comprehensive study published in the American Journal of Gastroenterology in 2023 highlighted the significance of this symptom in the early detection of colon cancer. The study found that rectal bleeding, which can manifest as bright red blood on the toilet paper or darker blood mixed with the stool, is a symptom that warrants immediate medical attention. The presence of blood in the stool may not always indicate colon cancer. It can be caused by less serious conditions like hemorrhoids or minor tears, anal fissures. However, the importance of this symptom lies in its potential link to more serious conditions, including colon cancer. The 2023 study emphasizes that any occurrence of rectal bleeding, especially if accompanied by other symptoms such as changes in bowel habits or abdominal discomfort, should be evaluated by a healthcare professional without delay. It's crucial to note that blood in the stool might not always be visibly red. Sometimes, it can be hidden, or what doctors call occult, only detectable through specific medical tests. Regular screening, especially for those in high-risk categories, is therefore essential for the early detection of colon cancer. Next, symptom 3, persistent abdominal discomfort. Moving on to another symptom, persistent abdominal discomfort is a significant indicator that should not be ignored. A study published in the International Journal of Colorectal Disease in 2021 sheds light on this symptom. The research indicates that ongoing abdominal discomfort, which can manifest as cramps, gas, pain, or a feeling of being full or bloated, might be an early sign of colon cancer. The study points out that these symptoms are often overlooked because they can be mistaken for common digestive issues. However, when they persist over a period of time, they could signify something more serious like colon cancer. This is especially true if these symptoms are combined with other signs like changes in bowel habits or rectal bleeding. It's important to note that these forms of discomfort can vary greatly in intensity and duration. The 2021 research emphasizes the need for individuals experiencing such symptoms persistently to seek medical evaluation. This is particularly vital for individuals who have additional risk factors for colon cancer, such as a family history of the disease, a personal history of polyps, or are over the age of 50. Next, symptom 4, weakness or fatigue. An often overlooked symptom of colon cancer is unexplained weakness or fatigue. In a study published in the Clinical Colorectal Cancer Journal in 2022, researchers discussed the impact of colon cancer on the body's overall energy levels. They found that unexplained weakness or fatigue, which goes beyond the usual tiredness and doesn't resolve with rest, can be an early sign of colon cancer. The significance of this symptom lies in its subtlety. Many people may attribute fatigue to their busy lifestyles or other health issues, potentially overlooking its connection to more serious conditions like colon cancer. The 2022 study highlights that this kind of fatigue can be due to the cancer affecting the body's ability to use energy efficiently, or due to internal blood loss leading to anemia, which is common in colon cancer. It's crucial for individuals experiencing persistent weakness or fatigue, especially if it's accompanied by other symptoms such as changes in bowel habits or abdominal pain, to consider a medical evaluation. This is even more important for those who have risk factors for colon cancer. And before we dive into the next symptom, hey, if this video has been helpful to you so far, a subscribe would mean a lot to us. What that does for us is it gives us an indicator that we are building an audience and that we are creating helpful content for people. Now, let's get back to the list with symptom 5, unexplained weight loss. Another symptom that demands attention is sudden, unexplained weight loss. A pivotal study published in the World Journal of Gastroenterology in 2023 delved into this phenomenon. The research found that significant weight loss without a clear reason can often be an early warning sign of colon cancer. Unexplained weight loss in the context of colon cancer is typically defined as losing more than 5% of body weight in a span of 6 months to a year without changes in diet or exercise habits. The 2023 study explains that this kind of weight loss can occur because the cancer cells consume a large amount of the body's energy. Additionally, colon cancer can affect the body's ability to absorb nutrients effectively, contributing further to weight loss. It's important to understand that while weight loss can be a symptom of various health issues, its sudden and unexplained nature, especially when combined with other symptoms like changes in bowel habits or abdominal discomfort, should prompt a medical consultation. This is particularly crucial for individuals who have additional risk factors for colon cancer. Other symptoms. In addition to the symptoms already mentioned, there are other, less common but equally critical symptoms of colon cancer that should not be overlooked. While these symptoms might be rarer, their presence can be indicative of the disease and warrant medical attention. 1. Nausea or vomiting. Persistent nausea or vomiting, especially when it's new or unexplained, can sometimes be a symptom of colon cancer. This can occur when the tumor causes a blockage in the bowel, affecting digestive processes. 2. Iron deficiency anemia. Unexplained anemia, particularly iron deficiency anemia, can be a sign of colon cancer. This often results from slow, chronic blood loss in the stool that might not be visibly apparent. Anemia can lead to symptoms like pallor, shortness of breath, and fatigue. 3. Narrow stools. Another symptom to be aware of is the consistent presence of narrow stools. While occasionally having narrow stools is not usually a concern, a persistent change should be evaluated, as it can indicate a tumor in the colon affecting the stool's shape. 4. Abdominal mass. In some cases, particularly in advanced stages, a mass or lump in the abdomen can be felt. This might indicate a sizable tumor in the colon. 5. Pelvic pain. In advanced stages, colon cancer that has spread to the pelvic area can cause pain or discomfort in the pelvis. It's important to remember that these symptoms can also be associated with other, less serious conditions. However, their presence, particularly in combination with other symptoms like those previously mentioned, should not be ignored. If you experience any of these signs, especially if they persist or worsen, seeking medical advice is critical for early detection and effective treatment of colon cancer. When to see a doctor. Determining the right time to consult a healthcare professional is crucial in managing your health effectively, especially when it comes to symptoms that could indicate colon cancer. Here are some guidelines. 1. Presence of symptoms. If you experience any of the symptoms discussed earlier, such as changes in bowel habits, rectal bleeding, persistent abdominal discomfort, unexplained weakness or fatigue, sudden weight loss, or any other less common symptoms, it's essential to schedule a visit with a healthcare professional. This is particularly important if these symptoms are new, have persisted for a significant period, or are worsening. 2. High-risk groups. Individuals who fall into high-risk categories should be more vigilant. These groups include those over the age of 50, people with a family history of colon cancer, individuals with a personal history of polyps, and those with genetic syndromes that increase cancer risk. If you belong to any of these groups, regular screenings are crucial, even in the absence of symptoms. 3. Regular screenings. Regular screenings for colon cancer are a vital preventive measure. Healthcare professionals generally recommend that individuals start regular screenings at the age of 50. However, if you have additional risk factors, screenings may need to start earlier. These screenings can include colonoscopies, stool tests, and other diagnostic procedures that can detect cancer at an early and more treatable stage. 4. Change in risk factors. If there's a change in your risk factors, such as a new family history of colon cancer, it's a good idea to discuss this with your doctor. They can provide guidance on whether your screening schedule should be adjusted. Remember, early detection of colon cancer significantly improves the chances of successful treatment. Regular screenings and prompt attention to symptoms can save lives. It's always better to err on the side of caution and consult with a healthcare professional if you have any concerns. Diagnosis and treatment options. Understanding the process of diagnosing colon cancer and the available treatment options is essential for anyone concerned about this disease. Diagnosis of colon cancer. 1. Initial evaluation. Typically, the diagnostic process begins with an evaluation of symptoms and a physical examination by a healthcare professional. This may include a digital rectal exam. 2. Colonoscopy. The most definitive diagnostic tool for colon cancer is a colonoscopy. During this procedure, a long, flexible tube equipped with a camera is inserted into the rectum to examine the entire colon. If any suspicious areas are found, they can be biopsied during the colonoscopy. 3. Imaging tests. Additional imaging tests, like CT scans or MRI, might be used to determine the extent of the cancer and whether it has spread to other areas. 4. Blood tests. Blood tests, including tests for tumor markers and a complete blood count, can provide further information about the patient's overall health and the presence of cancer. Treatment options for colon cancer. 1. Surgery. Surgery is often the first line of treatment for colon cancer, particularly in early stages. The goal is to remove the tumor and a portion of healthy tissue surrounding it. In some cases, lymph nodes are also removed and examined to determine if the cancer has spread. 2. Chemotherapy. Chemotherapy uses drugs to destroy cancer cells and is often used after surgery to eliminate any remaining cancer cells. In advanced stages, it can be used as the primary treatment. 3. Radiation therapy. Radiation therapy, which uses high-energy rays to target and destroy cancer cells, is more commonly used in treating rectal cancer but may sometimes be used in colon cancer treatment, particularly if the cancer has spread. 4. Targeted therapy and immunotherapy. These newer forms of treatment target specific aspects of cancer cells or harness the body's immune system to fight cancer. They are generally used in advanced or recurrent colon cancers. 5. Palliative care. In advanced stages, the focus might shift to palliative care, which aims to relieve symptoms and improve quality of life. It's important to note that the treatment of colon cancer varies depending on several factors, including the stage of the cancer, the patient's overall health, and personal preferences. A multidisciplinary team of specialists typically works together to determine the best course of treatment for each individual. Prevention and lifestyle tips. While some risk factors for colon cancer, like genetics and age, cannot be changed, there are several lifestyle adjustments you can make to help reduce your risk. Here are some key prevention and lifestyle tips. 1. Dietary changes. High-fiber foods. Incorporate more high-fiber foods into your diet. This includes fruits, vegetables, whole grains, and legumes. Limit red and processed meats. Reduce the intake of red meats, like beef, pork, and lamb, and processed meats, like sausages and luncheon meats. Diverse and balanced diet. Aim for a diet rich in various nutrients, which can help protect against colon cancer. 2. Regular physical activity. Engage in regular physical activity. Even moderate exercise such as brisk walking for 30 minutes a day can make a difference. Regular exercise helps maintain a healthy weight, which reduces the risk of colon cancer. 3. Avoid tobacco and limit alcohol. Quit smoking. Tobacco use is a significant risk factor for colon and many other types of cancer. If you consume alcohol, do so in moderation. Excessive alcohol consumption is linked to an increased risk of colon cancer. 4. Maintain a healthy weight. Obesity increases the risk of colon cancer, particularly in men. Strive to maintain a healthy weight through a balanced diet and regular exercise. 5. Regular screenings. Regular screenings for colon cancer are crucial. They are the most effective way to reduce your risk, as they can detect polyps before they become cancerous. The recommended age to start regular screenings is 50, but it may be earlier if you have a family history of the disease or other risk factors. 6. Stay informed about your family history. If you have a family history of colon cancer or polyps, you may need to start screenings at an earlier age and undergo them more frequently. 7. Consider genetic counseling. If you have a strong family history of colon cancer, genetic counseling can help you understand your risk and decide on prevention strategies. By incorporating these lifestyle changes and prevention strategies, you can significantly reduce your risk of developing colon cancer. Remember, the best approach is a proactive one, combining healthy lifestyle choices with regular medical screenings. As we come to the end of our discussion on critical colon cancer symptoms, let's recap the important points. We've covered several key symptoms to be vigilant about: changes in bowel habits, rectal bleeding or blood in the stool, persistent abdominal discomfort, unexplained weakness or fatigue, sudden, unexplained weight loss, and other less common but significant symptoms like nausea, vomiting, and abdominal mass. Remember, being aware of these symptoms and responding to them promptly is vital. The importance of early detection cannot be overstated. Colon cancer, when caught early, is highly treatable, and the survival rates are significantly higher. This is why paying attention to your body and seeking professional medical advice when you notice any concerning changes is crucial. Regular screenings, especially for those at higher risk, play a key role in early detection. We encourage you to subscribe and share this video to spread awareness about colon cancer. The more people know about these critical symptoms, the more lives can be saved through early detection and treatment.